Have you ever had a life-changing illness or diagnosis that has completely changed the way you live? I went to doctor after doctor for years trying to figure out what was wrong with me. Eventually, one doctor finally cared enough to hear me out. I was diagnosed with hidradenitis suppurativa, scared not knowing what in the world that was. According to the Mayo Clinic, hidradenitis suppurativa, better known as HS, is an inflammatory disease of the skin that has a devastating effect on quality of life. It is a very rare disease, given that only 0.1% of the United States people have HS. Having experienced the hardships of living with HS for a considerable amount of time, I believe that more people need to know about this disease. I want you to remember that having an autoimmune condition can be difficult, so please be understanding. In my speech, I want to talk to you about the symptoms, treatments, and the side effects of living with HS. HS is hard to diagnose, but once you know the symptoms, it is easier to look for. Hidradenitis suppurativa can cause mild to severe symptoms. It results in various skin conditions, including channels that leak pus, blackheads, cysts, boil-like bumps, and scars. There are 3 different stages of symptoms: mild, which is stage 1, moderate, which is stage 2, and severe, which is stage 3. In this diagram, I want to show you the different stages and how they look. Stage 1 has lesions without scarring, and it's not forming a sinus tract. Stage 2 has recurring abscesses, widely spread lesions, and starting to form sinus tracts. Stage 3 has multiple connecting sinus tracts, abscesses, and extensive scarring. But along with that, what is the main cause of HS? It's skin follicles and the way they react. The growing of the skin follicle is the reasons why you have the tunnels or the sinus tracts. It's skin cells that think each other are bad, and they're fighting against each other. And so it's just your body not fully knowing how to work. When I was diagnosed, I was classified as grade 1 or stage 1. And as I've gotten older and as I've matured and my body has just changed, I am now up to a stage 3, which is the most severe level. The next topic are the various treatments that a patient with HS are eligible for. Treatment options for HS are numerous. 3 main ways of treating is through antibiotic creams, injection shots, and surgically removing the drainage tunnels. Antibiotic creams can help with a flare-up, but not completely solve the problem. Can you put a small band-aid on a giant problem and expect it to be fixed? No. The most common way is through injection shots. But with shots, you have to go through trial and error to see which one works best for you. And among those shots, you might find one that leads to other problems you didn't even know you had. The last resort is surgically removing the tunnel. Most doctors are hesitant to perform this surgery because of the recovery time. It could be up to 10 weeks. You're not able to do anything. I finally have found a doctor willing to remove most of my tunnels. But even removing the tunnels surgically doesn't mean they're gone forever. It just means that hopefully they will not come back in the same spot. The last topic is the physical and mental effects that HS can have on you. Your life can be significantly altered by HS. Abscesses and prominent lumps are the physical aspects or impacts of HS, among the agony and occasional odor. You might even experience more mental challenges than physical ones. Among the mental challenges are, can people smell them? Can they see them? Additionally, you're emotionally exhausted from the lack of energy. You can't enjoy yourself or engage in activities. In conclusion, even though HS is not commonly diagnosed, more people need to know about this disease. I want you to know that dealing with an autoimmune disease can be challenging, so please be considerate. I have discussed side effects, therapies, and symptoms of living with HS in my speech. Keep in mind you never really know what's going on, especially when you're working with someone and they may not be pulling their full share of work. They may have a medical issue that they aren't willing or comfortable with sharing yet. Place yourself there and observe how it makes you feel.